So here's our update on vaccination in the city. We are making progress. So far, we have had 190,000 people in the city who have received their first dose of vaccine. 94,000 people have received their second dose. So we're closing in at 200,000 people, but remember, we have 1.2 million adults in the city. And the demographics of the people we're vaccinating is gradually becoming more diverse. Percent of people vaccinated with their first doses that are African American is now at about 22%, and that's up from 8% initially. All the data on our vaccinations is on our website, with now including a map that shows the vaccine uptake by zip code across the city. Now, the doses that are available to us is increasing pretty much every week now, and now it's much more so that the limiting factor is more than the number of doses that providers can deliver than the doses that are arriving in the city. Now, there's one important caveat to that, and that is we have ample doses of the Pfizer vaccine. The Pfizer vaccine is the one that needs the ultra cold storage and can only be handled by certain providers. But we do have a limited number of doses of the Moderna vaccine, which doesn't need that ultra cold storage. So we're encouraging hospitals to shift to doing the Pfizer vaccine exclusively and encouraging other providers that may be able to use the Pfizer vaccine to try to use the Pfizer vaccine. Now, in addition, you may have heard that the Johnson & Johnson vaccine is to be reviewed and may be approved and may be available next week. This vaccine has the advantage that it can be used in a single dose rather than having two doses. We've been told that if it is approved, that our initial allocation for the city will be about 13,000 doses, which is fairly small. And then we may receive none for about 3 weeks. Now, over the long term, I'm hoping the number of doses increases, but it will be just a small number of doses that we'll be getting initially. Now, the doses of vaccine that we have that we are administering is increasing. Last week, that ended on Sunday, all the providers in the city combined administered 40,569 doses. That was despite the fact that that week we had about a day or two of clinics that were interrupted because of snow. Now, for comparison, the week before that, there were 49,773 doses that were delivered. The week before that, it was 35,833. So we've been increasing, but last week I do think we were hit because of the snow. I'm anticipating continued increases from here. How is the vaccine being made available? Hospitals are continuing to invite people over the age of 75 or with medical conditions in for vaccination. And a number of hospitals are holding their own mass clinics in partnership with community organizations. Pharmacies are making the vaccine available, particularly the chains. Rite Aid is doing the most. They did about 9,000 doses last week. Also, ShopRite and Walgreens, Walmart will be having doses this week, and in the future, CVS. There are independent pharmacies likewise that are going to be making vaccine doses available. There are 8 approved sites now, independent pharmacies, that will be receiving vaccine this week. And there'll be more independent pharmacies approved and receiving vaccine each week from here. Federally qualified health centers and other clinics are all inviting in their patients, and their volume for vaccinations is increasing. And then there are mass clinics that are being operated. As you probably know, the health department has started a series of regular mass clinics this week. On Tuesday, we were at the Martin Luther King Older Adult Center in North Philly. On Thursday, we were at the Community Academy of Philadelphia Charter School in Juniata. That was yesterday. Excuse me. And tomorrow, we'll be at the University of the Sciences in West Philadelphia. The people that are vaccinated at the sites are people who are invited with our vaccine interest sign-up form who meet the phase 1B criteria. In addition to that, the Black Doctors COVID Consortium, as you probably know, last week did a 24-hour event. The total number of doses this organization delivered last week was nearly 5,000. I'm going to talk more in a minute, I hope, about the work that she's doing and hoping to be doing in the future. In addition to that, there's a federally supported site that will be providing vaccine at the convention center, what we're calling the Center City Vaccination Center. That will start next week on Wednesday with the target of vaccinating 6,000 people per day. That site is going to be available for at least 6 weeks. And we'll be inviting people to that site from the vaccine interest database. And in addition to that, there are special procedures in place to vaccinate frontline essential workers who are eligible at this point. So teachers and other school personnel and childcare workers in particular are starting to get vaccinated this week. The Children's Hospital in Philadelphia started on Monday at the Roberts Center at their campus. And next week, they will add to that 6 school-based sites for those vaccinations. So overall, we have a long way to go yet for vaccination, but we're clearly making progress. For anybody who wants to be vaccinated, I would recommend that you go to our website, www.phila.gov/COVID, and then look for vaccine interests or places. There's a lot of things you can see easily on the website of where you can sign up, provide your information, and then as these opportunities for vaccination become available, we will invite you to schedule an appointment. That's my update for today. Now I want to introduce Dr. Ayla Stanford, who started and runs the Black Doctors COVID Consortium, I'm sure everybody's heard about, so that she can talk about the efforts of her organization around vaccination. Dr. Stanford. You're on mute.
Thank you. Thanks, Dr. Farley. So most of you know, the Black Doctors COVID-19 Consortium was founded back in April to help bridge the gap with testing in communities where there were not a lot of testing. And of course, there was no cure, there still isn't. And testing and contact tracing was what was most important. And so we set up mobile units in different parts of the city to bridge that. To date, we have tested about over 25,000 people, and it was a natural transition for us to begin vaccinations. So on January 16th, that was our first vaccination clinic in North Philadelphia, and we have been in North Philly and West Philadelphia, and of course at the Leah Chorus, where the prevalence of disease has been highest. The positivity rates and also the vaccination rates have been low. Just to give you some of our statistics, we have had 20 clinics so far, and we have vaccinated 15,871 people. The demographics for that are 72.3% Black, 3.9% Asian, 18.5% white, 2.5% Hispanic, and 2.8 where we had unknown or not listed. We also have that broken down by age and gender, which I can certainly comment on if you all have questions about that. Some important things about what's happening right now with us. Previously, we had an electronic registration system, and it quickly got up to about 50,000 people. And even though there were 50,000 people, many of them were not meeting the 1B criteria, and many of them were not from communities that were hardest hit. And we were worsening a health disparity, if you will, because those who didn't have access to phones and computers were unable to register. And so we have sent out invites to all the folks who registered with us and requested a vaccine. But as of March 1st, we will no longer be doing any registrations on the computer, on the phone, and everything, or the phone, everything will be first come, first serve. We have a certain number of doses allocated to us per day. And when we exceed or we get to that number, we will stop the line. And we will do that 4 to 5 days per week, as we've been doing. And we will continue to focus on the hardest hit zip codes unless something comes out from the Department of Public Health that now the vaccination rates are at the level where we would like them to be. And we are asking you to be a Philadelphia resident and be 1B criteria, either by occupation or by a health condition. Of course, those who are 75 and up only have to be 75 and up. And that is it. And let me see if there's anything else I'd like to add. Oh, yes. So our 24-hour Vaxathon, I just wanted to say thank you to the city of Philadelphia, all the residents that came out, and also to the Department of Public Health and the mayor for bringing forth a vaccine for us so that everyone in line could receive a vaccine. And though it was a success from that perspective, there are many areas where we could improve. And I'm excited to be talking to the folks at Temple and also the Office of Emergency Management, the fire department, police department, of course, the mayor's office, to when we have to give the second doses to those nearly 4,000 people, that it is much more streamlined. And it will be the week of March 21st that will be there. And right now we're planning on 2 12-hour days to get that accomplished. But again, very excited about the collective, collaborative approach of these different divisions throughout the city so that we can make it better than it was. And so that concludes my remarks.
Thank you very much, Dr. Stanford. We'll now turn things over to Armando to provide a Spanish language translation. Armando?
Actualización en relación a la administración de vacunas para el 26 de febrero del 2021. En cuanto a los números de personas vacunadas, hoy reportamos que 190,000 personas han recibido las primeras dosis y 94,000 personas han recibido la segunda dosis, de un total de 1.200.000 adultos. También reportamos avances en la distribución geográfica y demográfica y vemos que esta se está diversificando gradualmente. El porcentaje de personas afroamericanas que ha recibido la vacuna es ahora del 22%, lo cual supone un aumento grande del 8% inicial. En cuanto al análisis de los códigos postales, las zonas de bajos ingresos y minorías, con una tasa de vacunación inferior, se encuentran en el norte de la ciudad y en el área de Kensington. En el sitio web se muestra un mapa que muestra la distribución de la vacuna según el código postal. Reportamos también un aumento en el número de dosis disponible. Pero ahora el factor que nos limita es tener más dosis de lo que los proveedores pueden distribuir, no la escasez de dosis en sí. Un hecho importante a tener en cuenta es que tenemos abundantes vacunas de Pfizer que requieren almacenamiento ultrafrío y que solo algunos distribuidores pueden ofrecer, aunque hay un número limitado de vacunas de Moderna que no necesitan almacenarse en frío. Estamos animando a los hospitales a utilizar exclusivamente la vacuna de Pfizer y a los demás proveedores a probarla también. Además, estamos esperando que la vacuna de Johnson & Johnson sea aprobada la próxima semana. Esta vacuna requiere una dosis única. Aunque anticipamos que la cantidad inicial que vamos a recibir sea pequeña, aproximadamente de 13,000 dosis, y luego no recibiremos ninguna vacuna durante las siguientes 3 semanas. En cuanto a las dosis de las vacunas ya suministradas, hoy reportamos que estas han aumentado. La semana pasada se administraron 40,569 vacunas. Solo hubo una breve interrupción de 2 días debido a la nevada. 49,773 vacunas se suministraron la semana antepasada y la semana anterior a esta fueron 35,883 vacunas. En cuanto a los hospitales siguen recibiendo a los mayores de 75 años de edad y a aquellas personas con condiciones médicas de alto riesgo. Con respecto a las farmacias, contamos ya con más de 75 cadenas participando. Rite Aid recibió 9,000 dosis la semana pasada y también estamos en conversaciones con ShopRite, Walgreens, Sunray, Walmart, Acme y con CVS o CVS en el futuro. Hay otras farmacias independientes que ya se han incluido en este programa. Hay 8 centros que ya han sido aprobados y que están recibiendo dosis semanalmente, y habrán más que se unen cada semana. En cuanto a los centros de salud aprobados por el gobierno federal y los centros de salud comunitarios, todos están recibiendo pacientes y los números van aumentando. En cuanto a los eventos de vacunación masiva, las clínicas masivas del Departamento de Salud empezaron esta semana. El martes en el Centro de Adultos Mayores de Martin Luther King en el norte de Filadelfia, el jueves en el Community Academy de Philadelphia Charter School, en la parte noreste de Filadelfia, en la sección de Juniata, y mañana sábado por la mañana en la Universidad de las Ciencias en el oeste de Filadelfia. Seguimos invitando a las personas que cumplan con los criterios de la fase 1B a que se registren en el portal de la ciudad. Y estaremos enviando correos electrónicos y llamando a las personas cuando haya citas disponibles. Reportamos que el evento de 24 horas del Black Doctors COVID Consortium de la semana pasada suministró ya casi 5,000 dosis. Y la clínica, apoyada por el gobierno federal en el centro de convenciones de la ciudad, comenzará el próximo miércoles. Nuestra meta es vacunar 6,000 personas por día y hacer esto al menos durante 6 semanas. En cuanto a los trabajadores esenciales, el Hospital del Niño de Filadelfia ha empezado esta semana a suministrar vacunas a los maestros, al personal de apoyo y al personal de cuidado infantil. La próxima semana vamos a añadir 6 centros en las escuelas mismas. Y estas son unas actualizaciones con relación a las restricciones del programa Safer at Home o Más Seguro en Casa. Los números de casos continúan disminuyendo y los números de personas vacunadas continúan aumentando. Actualmente, Filadelfia tiene más restricciones que las que impone el Estado y estas van a expirar el día 28 de febrero. Hoy anunciamos que se relajarán las restricciones cuidadosamente a partir del 1 de marzo en cuanto a los límites estatales en relación a los eventos y reuniones. Hay otras normas que también se han relajado y si el Estado levanta más restricciones, consideraremos si debemos igualarlas. Nuestras normas dependen del uso consistente y universal de las mascarillas. Si no es así, entonces no son seguras. El uso de la mascarilla es algo obligatorio en todos los casos. La única excepción es cuando se consume bebidas o comidas. Así que los límites varían en función sobre si se sirve comidas o bebidas. Los límites estatales actualmente indican que en interiores hay un 10% de capacidad máxima si es menor a 2,000 personas, un 5% de máxima capacidad si es entre 2,000 a 10,000 personas, con un tope de 500 asistentes. Al aire libre.
Armando, if I can interrupt, Armando, it looks like you're reading into our second round of comments around the safer at home restrictions. I'm just noticing.
That's right.
I apologize. Can we hold off on that? And I apologize to everyone for the delay on this.
Regresaremos a la actualización con relación a Safer at Home después. Una pausa y volvemos con el programa original. Gracias.
Thank you, and apologies again for everyone for that. I would like to turn it over to the questions and answers for Dr. Farley and for Dr. Stanford about the COVID vaccine distribution effort. For those logged in today, please use the raise your hand feature, same as usual. And if you can use video, we would appreciate that. I'll now introduce, to start with us, Jeff Cole from Fox 29. Jeff, go ahead. My apologies, Jeff. I hit your button twice. You can unmute now.
Here we go. For Dr. Stanford. Hello, Dr. Stanford. How are you?
Hello. Great. Hi.
Good. First question I have for you. Do you think now that you've been able to look back at your 24-hour vaccination effort, the 4,000 people or so that you were able to apparently vaccinate, I know that you're going to do a follow, the second doses, but will you do that again? How will you change your approach in any way if you are?
So one, it'll be in a warmer month. So I think probably the end of April, beginning of May, we may do it again if there's a need. You know, we're trying to get vaccines off the shelves, as they say, into arms, particularly in a community where there were not many vaccinations. The rate was less than 10% in terms of vaccinations. And I can definitely say we have contributed to that number going up above 20%. With FEMA coming and with all the other clinics coming about, we may not need to do it. But the one thing I would change is one, I would think the end of April, beginning of May, when it's a little bit warmer. We're already in talks with the the fire department, Office of Emergency Management, police department, and all the folks at Temple, from security to facilities to operations and logistics, because if they can get 10,000 people in for a basketball game, surely we can do better. And with some of the restrictions being lifted, we'll be able to put more people in to that square foot arena. You know, prior to, we didn't want to create a super spreader event, which precluded us from really utilizing all of the space. So that's what we would do differently.
I follow up with that. You say, if there's a need, so you would continue to vaccinate, you just wouldn't vaccinate at that scale around if there's a need. Are you thinking that maybe you can stand down at some point?
I think we've got a ways before we can stand down, but as long as, you know, folks are willing and we've got the support and there's vaccine, I mean, it was a fairly productive, effective, though room for improvement, way to get it done. And so that's what I would say. I think there's lots of different methods to get to the same goal. And we're trying to get to herd immunity. We're trying to decrease transmission. And that was a fairly effective way to do it, although always room to do it better.
Thanks. And just one quick one for Dr. Farley. I understand, Dr. Farley, there's limited Johnson & Johnson supply at the top. So why no supply of Johnson & Johnson for 3 weeks or so after that? They're going to just blow out all they have and then try to catch up later?
This is just what we've been told by the federal government is that they have this allocation, and then we can expect little to none for the next 3 weeks. I don't know, the production issues beyond that. They seem to say that there's a lot of vaccine that they will be producing in future months. So I'm optimistic over the long term, but we just need to be, like the rest of the country, we'll just have very limited at first.
Thank you. Appreciate it. Thank you.
Thank you very much, Jeff. Next, we'll turn it over to Annie McCormick from 6ABC. Annie, go ahead.
Hi, how are you? Dr. Stanford, can you elaborate a little bit more and maybe for me just a clarification on when you were talking about the signing up? I thought I heard you say that you had been doing it electronically. Now you're going to push people to the phone number and then it's going to be first come, first serve. Can you just clarify that for me?
Sure. So initially we had a registration portal like everyone, basically that you're interested because we didn't really have all of the doses yet. But what happened with that is we watched the numbers go from being 90% African-American drop down to 50%. And a lot of that we learned was that people would say, well, I tried to register online and my phone only let me do half of it. After I tried several times, I gave up and decided I would just show up. And what we were doing was making a health disparity worse because the people who we were focused on getting the vaccine were having a challenging time with the message, the way we were using it. So February 10th, we shut down our electronic registration completely. And then we sent out emails to folks who met criteria for 1B to come over the past 2 weeks, which is why we've been having 1,000 a day vaccination clinics and so forth. But as of March 1st, Monday, there's no longer any electronic anything. It's going to be, we're going to publish where we are publicly so people will know where we are. And we're going to have a set number of doses per day. And when those doses run out, we're done with the clinic for the day. It was the most equitable way that we felt that we could do it to give everyone an opportunity, those with a computer, those without a computer. And there are other ways. Some people are calling on the phone and registering people on the phone. And that's another way, but it takes a lot of time to call people and take all their information over the phone and schedule an appointment. So I think there's just sort of different ways to get to the same goal. And this is what we're doing.
Thank you. And I have one question for Dr. Farley too. And I know we ask you this every week, but do you have an idea of where we might be in regards to moving up to the next category? Like, do you have a timeline idea at this point, knowing how many vaccines you're getting and not getting?
Yeah, I've estimated before that we'll be in phase 1B probably until around the end of April, and then we'll be in phase 1C after that. Now, that's a guess. The biggest unknown is we don't know what percentage of people in phase 1B want to be vaccinated, but we also don't know how many doses we're going to get. So, but if people want to have a rough idea of when it's going to be that we'll move to phase 1C, or to phase 2, which would be for open to anyone, that's it. So phase 1B till the end of April, phase 1C till the end of May, and then in June, we're in phase 2.
And just a quick follow-up, could getting a large amount of vaccines change that timeline dramatically? Like, I guess I'm asking what would it be that would change that, move that timeline up? So
there are two limiting factors. One of them is how many doses we receive. The other is how many doses all the healthcare providers that are vaccinating in the city can deliver. And right now, it's that second, which is more the limiting factor. So it would be great if we got a lot more doses of vaccine. It would hurry things up, but we do have some limits on how quickly other vaccine providers can set up clinics and get their staff trained and do all the work around this. And so it would still, take some time to get up to scale.
Thank you.
Thank you very much, Annie. Next up, we're going to go to Ryan Briggs from WHYY. Ryan, you've got the floor.
Hi, this is for Dr. Farley. So we understand invitations have been going out for the FEMA site electronically, a link to register. So I was curious, who's getting that invitation And, is there any sort of password protection or other sort of, standards to, I guess, prevent people from just circulating the link, signing up? Is there any notice or requirement on the form for eligibility? And finally, how does that balance with some of Dr. Stanford's comments about how they're moving on from the kind of pre-registration system to a first come, first serve model?
Right. So we have over 200,000 people in our vaccine interest database. And so we have used those to invite them to the clinic in Center City. And we have oversampled, as we've drawn those names out, people who live in the zip codes that have the lower vaccination rates right now. So substantially oversampled to give a better chance for people in those lower vaccinated zip codes. Now, we do have problems in that people share those links with other people, and then other people who are not invited can get in. We're trying to work on an information technology solution to that. This is a problem from my discussions that people are having nationwide with the software where links get shared. And so we're trying to do various workarounds to prevent that, but that we certainly cannot totally prevent that. And so and those people are invited both by email and by telephone. But it is not a perfect system. And so having complementary systems like Dr. Stanford's system, which is just walk up, is advantageous for people who don't have internet access at all or really just not comfortable with setting up an appointment in advance.
Thank you. Ryan, is there anything else? All right, then we will move on to Laura McChrystal from the Inquirer. Laura.
Hey. Dr. Farley, I wanted to ask about what you said about the Pfizer vaccine, you having in greater supply and only hospitals can give that out. Can you give us a sense of how many, is there a backlog of the Pfizer vaccine doses sitting in hospital freezers? How many are going unused?
We don't think any of them will go unused, but there definitely is Pfizer vaccine in freezers or in the hospitals across the city because it's a limited number of providers that really have the ability to use it, and there's only so many people that can vaccinate per week. So I don't have a number for you, but yes, there is some amount of backlog there, if you want to call
it. Okay, and are only hospitals giving out the Pfizer vaccine at this point?
No, there are some other providers that have developed the ability to do that. Some pharmacies are using the Pfizer vaccine. We are talking to some of the federally qualified health centers to see if they can use the Pfizer vaccine. And I think that's pretty much the limit to it. But the more providers we have who can use that vaccine, obviously the more vaccines we can get out there quickly.
Okay. And is there any percentage or number you could give us for, the doses you're getting per week versus how many of those doses are being administered to people in that same week versus going unused?
Well, yeah, we can get that data to you. I'm not off the top of my head because I don't want to be inaccurate, but we can get that data to you.
Okay. Could you generally say whether you think you should be doing better with that percentage, or is it?
Yeah, we would like to have a greater percentage of the vaccine go out quickly. Now, you don't want to be too, it's impossible to have the moment a vaccine dose arrives, get into people's arms. And if you do that, try to get close to that, then you do run the risk of an interruption in supplies. As you know, last week, many sites did not get the Moderna vaccine shipped to them because of the weather problems in the Midwest. So it's good to have a certain amount of inventory to deal with that problem, but we would like to get the vaccine we have out quicker. As I said, the greater problem right now is not the doses available to us, but how quickly we can get those doses into people's arms.
Okay, thank you.
Thank you very much, Laura. Next up, we're going to move to Lauren Make from Channel 10. Lauren?
Hi, guys. Good afternoon. Regarding the Johnson & Johnson vaccine, Dr. Farley, that you mentioned, you said you're going to expecting that if it's approved, you'll get 13,000 doses. Where would those doses go? And how would you decide where they go? And then in connection with that, would those would the Johnson & Johnson vaccine, if approved, be used at the convention center FEMA site, given that it's only going to be up for 6 weeks?
So no, not initially. The Johnson & Johnson vaccine is likely to go to other healthcare providers. It's a little bit complicated because it's a single dose vaccine, and there's a real advantage to that. But the efficacy of that vaccine is a little less than if you try to compare one study to the others, than the Pfizer or the Moderna vaccine. And so I think all these vaccines are excellent. I would be happy to take any one of these vaccines, but in some people's minds, it may be perceived as a less effective vaccine. And so the question about who is appropriate to receive it, I think does need to be best done in a conversation between a physician and the patient. And so I think a healthcare provider that are vaccinating their patients are the best ones to have those conversations. So we'll be making it available to healthcare providers. Initially, it'll be a fairly small number of doses to each healthcare provider in the city, but that's the best way to use this, at least at first.
I understand what you're saying about the conversations between a patient and their doctor, but the health department would have to make a decision who to allocate those 13,000 doses to. Where would you send them?
So when I say healthcare providers, mainly we're talking about hospitals and then clinics.
Okay. So not to some of the other providers that you've been working with?
I think it wouldn't fit well in a community mass vaccination sites where they're otherwise have different vaccines and people are coming out for second doses. Mixing them can just confuse everyone. And also then you don't have a great opportunity for the doctor and the patient to have a thoughtful discussion about whether this vaccine or that vaccine is more appropriate. But you can have that discussion in a clinic where the patient has a relationship with the doctor or a hospital where the patient has a relationship with the doctor.
Thank you.
Thank you very much, Lauren. We'll now move to the second portion of today's program. And I want to make sure that I take time to thank Dr. Stanford for her participation in today's program. So Dr. Farley will now be moving on to announce updates to the city's Safer at Home guidance. Once he's finished, we'll have Armando restart from the beginning of that and provide a Spanish language translation. Then we'll move to Q&A. Dr. Farley, back to you.
All right, thank you very much. So as you know, the case rates of COVID in Philadelphia are falling and our vaccination rates are rising. And now for some time now, the city of Philadelphia has had restrictions that are tighter than those in the state of Pennsylvania as a whole. And the current executive order that expresses those restrictions is set to expire on February 28th. So it's appropriate for us now to consider relaxing those restrictions. So we will be relaxing restrictions effective March 1st. Now the state Pennsylvania does have its own limits, particularly on events and gatherings. So we'll be relaxing our restrictions to those state limits or to something similar. And if the state relaxes its limits further, we'll consider whether we want to match that. Let me give you a little more detail, but before I do that, let me point out that all of our changes are dependent upon consistent, universal mask use. Masks are very effective in preventing this infection. If people are not wearing masks, then the changes we're talking about here are not safe. So all of this is going to mean that mask use is required in all these settings, with the exception, excuse me, of when food or drink are consumed, because you can't be wearing a mask when you're eating or drinking. So our limits will vary according to whether food or drink is consumed in the setting. I'm going to just summarize what the new limits will be effective March 1st, and then we'll be providing detailed guidance on each of these settings that will be posted later today. So retail stores in Philadelphia right now are limited at no more than 10 persons per 1,000 square feet. That will rise to 20 persons per 1,000 square feet. Senior centers, which have been closed since the beginning of the epidemic, since the March of last year, will be for the first time allowed to open, but everybody participating in these sites will have to wear either KN95 mask like this, or to double mask, to wear a procedure mask with a cloth mask on top of it. That provides the best protection from COVID-19 spread from one person to another. We know these seniors are particularly vulnerable, so we want to be very careful. There's also will be a limit in these senior centers of no more than 25 people in any one room, in any one group. Now, restaurants in Philadelphia are currently limited to no more than 25% capacity, with a recent option added that they can go to 50% capacity if the restaurants meet our standards for high levels of ventilation. And we're not going to change that as of March 1st, but we'll make one change, and that is currently we're limiting restaurants to have no more than 4 persons at a table, indoors or out. So we will change that to be outdoors. People can have up to 6 persons per table, and will no longer require that those people be from the same household. Let's go on to events and gatherings. Now, the state has limits on events and gatherings in venues like with seatings like theaters. They're a little bit complicated. Let me just explain what they are. Indoors, venue is allowed to have 10% of its maximum capacity if the maximum capacity is less than 2,000 seats, or 5% of its maximum capacity if the maximum capacity is between 2,000 and 10,000 seats. And there's a total cap of no more than 500 persons on an indoor gathering. Outdoors, the state's limits say that the maximum use is 15% if the maximum occupancy is fewer than 2,000 seats. It's 10% if it's 2,000 to 10,000 seats, and it's 5% if it's more than 10,000 seats. And there's an absolute limit for outdoor gatherings of 2,500 people. So those are the state limits right now. And that's what we cannot be less restrictive than the state limits. So in theaters now in Philadelphia, we will be dropping back to the state gathering limits, those limits that I just gave you. And we will, for the first time, allow food to be served in things like movie theaters. However, in movie theaters, people will have to sit in groups no larger than 4. So people, the movie theaters have wanted to allow people to consume food while they're watching movies. They can do that, but with that, those state limits on gatherings and this limit on the party size. Our other gathering events will follow the state limits, except for catered events. Now, catered events are the events that we worry about the most. These are the places where people get together, typically indoors, not wearing masks because they are eating food and consuming beverages. They interact, they move around, lots of potential exposures. Many outbreaks have been associated with these settings. So we are still prohibiting indoor catered events. Outdoor catered events are allowed, but the maximum number of people at those outdoor catered events is 100. It was previously 50. And then religious services have been capped up until now at 10% capacity. We'll allow that to increase to 20% capacity. And then sports. We've had restrictions in the past on indoor sports in particular. With this change, we'll be allowing indoor sports and allowing outdoor sports, and spectators will be allowed up to the state gathering limits. So these are changes that will go into effect on March 1st. They are a little bit complicated, but we're getting us more closely in alignment with the state, and it's one step closer to us returning to normal. I'll stop there and be happy to answer any questions.
Before we do that, thank you very much, Dr. Farley. I'll now ask Armando to read those prepared remarks on the safer at home transition now. Thank you very much. Armando, please go ahead.
Actualización en relación a las restricciones del programa Safer at Home, más seguro en casa. Los números de casos continúan disminuyendo según los números de personas vacunadas siguen aumentando. Actualmente, Filadelfia impone más restricciones que las que impone el Estado y estas van a expirar el 28 de febrero. Por eso, hoy anunciamos que relajaremos cuidadosamente las restricciones a partir del 1 de marzo a los límites estatales en cuanto se refiere a los eventos y reuniones. Otras normas también se han levantado y si el Estado relaja más restricciones, consideraremos si la ciudad también debiera hacerlo. Nuestras normas dependen del uso consistente y universal de las mascarillas. Si no es así, entonces no son seguras. El uso de la mascarilla es obligatorio en todos los casos. La única excepción es cuando se consume comidas o bebidas. Así que los límites varían en función de si se sirve comidas o bebidas. Los límites estatales actualmente indican que en interiores hay un 10% máximo de capacidad si el aforo es menor a 2,000 personas, un 5% de capacidad máxima si es entre 2,000 a 10,000 personas, con un tope de 500 asistentes. Al aire libre hay un 15% de máxima capacidad si el aforo es de 2,000 personas, un 10% si es entre 2,000 a 10,000 personas, un 5% si es mayor a 10,000, con un tope de 2,500 asistentes. Ahora pasemos a un resumen de los nuevos límites para Filadelfia. Nuestras instrucciones detalladas se van a publicar hoy mismo. Los comercios minoristas pasan de 10 a 20 clientes por cada 1,000 pies cuadrados. En los centros de ancianos se permite su apertura a visitantes con el uso de doble tapabocas o mascarilla KN95. Se permite 25 personas máximo por grupo. Con relación a los restaurantes, se permite ahora hasta 6 personas por mesa al aire libre. No hay cambios en las normas del 25 o el 50% de capacidad vigentes actualmente si es que hay excelente ventilación. Con relación a los eventos con catering, recordamos que estos eventos son los de mayor riesgo, como las bodas, por ejemplo, donde se celebra con comida. Estos eventos siguen prohibidos en interiores, pero sí se permiten al aire libre con un máximo de 100 personas que asistan. En los teatros tenemos el mismo límite que tiene el Estado. Se permite comida, pero hay que sentarse en grupos de menos de 4 personas. En cuanto a otras reuniones y eventos, también estamos relajando las restricciones al nivel que tienen los límites estatales. Además de estos cambios en los eventos en general, también quería compartir una breve actualización sobre el plan de la ciudad para la concesión de permisos para eventos especiales. En julio del 2020, la ciudad anunció que temporalmente dejaría de emitir permisos para eventos especiales debido a la pandemia del COVID-19. Esta normativa, que actualmente expira el 1 de marzo del 2021, se extenderá al menos hasta el 15 de marzo del 2021. Nosotros compartiremos más detalles sobre cuándo la ciudad volverá a aceptar solicitudes de permisos para eventos en espacios públicos en las próximas semanas. Y un último recordatorio. Los servicios religiosos pasan del 10% al 20% de aforo, y los deportes se permitirán en interiores y en espacios exteriores dentro de los límites que permite el Estado. Muchas gracias. Jim?
Thank you very much, Armando. I was having trouble finding the button there. We'll now move to the Q&A portion of today's second round for members of the media. As usual, reporters are asked to limit their questions to 3 or fewer, and we'll do a second round of questions if we have time for it. Please try to keep your questions focused on the topic at hand. First up, we are going to go back to Annie McCormick from 6ABC. Annie, go ahead.
Dr. Farley, I just wanted to ask you about the events and gatherings in regards to the fact that the state restrictions are still in place. What are your thoughts on, if you didn't have those state restrictions, what would your decision be at this point with the levels that we have? Do you think it would be okay to let fans in the stands at a Phillies game?
Well, the current state restrictions would allow fans in the stands at a Phillies game. If you see them, there would be a limit of 2,500 under the state limits. And I would just say if the state wanted to raise that, we would have to look and see what they're suggesting and see if we feel it's appropriate.
But as far as what Philly's seeing, I mean, so many of the decisions are made just about Philadelphia within our own restrictions. Right. You've put stricter restrictions in place than the state has. So do you think at this point that there could be, that the state, it would still be safe to make it a little bit larger, to have more people?
I'm not sure. I know we definitely are comfortable going to what the state limits are right now. Right now, Philadelphia's case rates are lower than the state as a whole, and has been lower for a while. And I'm optimistic about the fact that they're falling in addition to that, and that our vaccination rates are rising. So there's no question we're moving in the right direction here. So I'm not willing to say now whether more than 2,500 is appropriate. Certainly if the state changes, we'll look at that, but I definitely am comfortable with the changes that we have here going to that state limit.
And just a quick follow-up question for you too, in regards to restrictions. When we were in the beginning of this, we kind of were giving a little bit of predictions of if we did X, Y, Z, this is what you could see may open up in X amount of time. What are you looking at right now when it comes to spring and early summer? If we hit a certain mark, what else could be open, and when do you think it could be?
I need to be careful not to make predictions, because I made predictions in the past and have proven to be wrong. The virus will continue to surprise me. I can say right now that I'm optimistic about where we're going in the next few months. Most respiratory viruses get better in the spring and they hit their lowest point in the summer. And then in addition to that, we got the vaccination, which is scaling up nicely now. And so we have two things very strongly in our favor. So it's the fact that I am optimistic that permits me to be comfortable with the changes we're talking about here today. If things continue to go as well as I hope that they go, then we'll continue to be able to scale back on restrictions, but I can't say at what rate.
Thank you.
Thank you very much, Annie. Next, we're going to go to David Melandra. David, go ahead.
My question is for Dr. Farley. Can you, for allowing the fans back into the stands, will they have to require proof of vaccination or a negative test?
No.
Okay, and as of right now, where the attendance stands, it's 2,500 for outdoors and 500 for indoors?
Correct. Those are the state's limits now.
All right, thank you.
Thank you very much, David. Next, we'll move to Denise Clay Murray. Denise, you want to go ahead?
I'm sorry. You said, my question's for Dr. Farley. You said the cater events are still out because they're indoors and people are eating and they don't have masks on and different things. To change that in the future, what are you looking for in terms of the number of cases and whether or not, I guess, what are you looking for to change that dynamic?
We're going to be looking at the case rate, how many cases per capita we're having. Then we look at the trend in case rate. If it's going down, I'm going to be feeling much better than if it's level or going up. And we're also going to look at our vaccination rate. And we're also going to look at our mortality rate. You know, if we are targeting our vaccinations appropriately, then we are protecting the people who are most likely to die. And if people don't die from this infection, then I'm much more comfortable with having cases occur in the community. Again, if you recover from this, then it's not that bad. So those are the four things I'm going to be looking at and weighing.
Okay, thank you.
Thank you very much, Denise. Next, we're going to move back to Lauren Make from Channel 10. Lauren, you've got the floor.
Hi again, Dr. Farley. Regarding, I have a couple questions about the restrictions. First of all, regarding the sports venues and large venues, the indoor ones, would that 500 also have to include the teams and all of the people working
Yes.
at the venue?
That's my understanding of the way that the state interprets those, and so we would interpret that the same way.
Have you had conversations with the teams about how now to approach this, given that they will be able to have some fans, and what have those conversations been like?
So, we know that you're talking about the professional teams. Mm-hmm. They proposed to allow fans in. I have not had a conversation with them. We've received ideas from them, but we'll be having conversations with them in the near future.
Would those venues or theaters or other large venues be able to set their own guidelines for who gets in? I mean, you had just said there won't be a requirement for tests or vaccinations or anything like that. Are large venues allowed to set their own rules?
I don't think it's practical and enforceable. How do you know that someone's vaccinated? It could be easy for someone to produce a card that shows vaccination. You don't know they were really vaccinated, or easy for someone to fake something that claims that they were infected. So I don't think that's practical.
And regarding the catering that is not going to be allowed inside, a lot of those venues are very large spaces. Why are they not considered under the gathering limit instead of under a special category? Because if it's there's a different rule according if there's basically no seating or no assigned seating, like a hotel ballroom. It doesn't matter how big the hotel ballroom is. If you have a lot of people together and they're clustered together, not wearing masks, singing and dancing, there's a great risk there. Okay. Let me just, before I let you go back to the first thing I was asking about regarding the indoor spaces and the proposals that the sports venues and teams have made. Have you heard that there is a plan to have fans in the immediate future in Sixers games, for example? They have proposed to have fans back in the stands. We are allowing that to the extent the state allows that now. So that's basically they're allowed to do that within consistent with those limits that I just put there. Now, if there's more discussions. And to increase that number, they would have to get approval from both the state and from us. Okay, thank you.
Very much, Lauren. We're going to move back to David Melandra. Go ahead, David.
I got a quick follow-up one for Dr. Farley. Before you said when fans were allowed, there was not going to be tailgating allowed. Will tailgating be permitted back, or is that too soon?
under the standards, as I understand it, would not prohibit tailgating. Now that there's, I think I would have to get an interpretation from the other people I'm talking to, but I think there would be a limit on the number of people that could be together one space tailgating, though.
And have you had talked to like other health commissioners in other cities, how they've been able to allow the fans back into their venues?
I haven't. And I talked to them on other issues. That issue has not come up.
Okay, thank you.
Thank you very much, David. This will be the last call for questions. If there are any other further questions from the press. I'm not seeing any other raised hands, though. So I will say that concludes today's press conference. Thank you all very much for your participation. Thank you to Dr. Stanford for her participation, and for all of you for covering this important topic. We will be back on Tuesday with the city's regularly scheduled press briefing. Have a nice weekend and stay safe.